reports published yesterday by the CDC say nearly 18 million Americans experienced symptoms of long COVID in 2022, and nearly 9 million people currently have the condition. Now, the condition occurs when patients have symptoms at least 4 weeks after they have cleared the infection. In some cases, symptoms can be experienced for months or years. So here with me now in Studio 57 is Dr. Celine Gounder. She's the editor-at-large for public health at KFF Health News and a CBS News medical contributor. Really good to have you here. We are seeing a resurgence of COVID with the sort of new strains, so I think it's a really good time to talk about long COVID and what we have learned so far about it. So among the things we have learned with some of these findings is that it's more common in women than men, more common in Latino patients than other racial groups, and occurs frequently in adults between the ages of 35 and 49. I mean, does that give us any more insight into long COVID? Does that inform how we treat long COVID?
So with respect to the racial differences, Hispanic people, we know especially early in the pandemic, Hispanic people were more likely to be exposed. They were more likely to be essential workers, so more likely to be infected. And so I think that's part of what you're seeing there. We are starting to learn a lot more about what causes long COVID. So there's a study just out in the last week or so showing that there are three main factors we see in people with long COVID. One is abnormal T cell function. So that's part of your immune system that's not working properly. Low cortisol levels. Cortisol is a stress hormone. Now, you don't want your stress hormones to be too high.
No, we're always talking about bringing those down.
But if they're too low, then your blood pressure can really drop, and then that can lead to all kinds of other problems. And then the other thing we see is reactivation of viruses. These are viruses like the chickenpox virus, the monovirus, what we call EBV, which never really go away. Your immune system just control. But if you think about maybe you're not controlling them as well, mono, you don't feel great. You feel tired, right? You feel kind of yucky. So if these are coming back in the middle of long COVID, it stands to reason that you're going to have some of those symptoms.
So I guess that's good news, because as I understood it before, long COVID was basically you had the virus, you still feel bad. We ruled out everything else, so maybe you have long COVID. But does this mean that we could be moving closer and closer to an actual test?
Yes. So that is the hope, is that using a combination of some of these factors that I'm describing, that we could come up with a blood test that could tell you, do you have long COVID? I think that data that came out from the CDC about how many people have long COVID, it's how many people have long COVID symptoms. And many other things can also cause those symptoms. So I don't think, those numbers are exactly, probably a big overestimate, actually, of how many people have long COVID per se.
Right.
But it's important to know the difference. Is this long COVID? Is this chronic fatigue syndrome? Is this an autoimmune disease? Because the treatments are not necessarily the same.
Right. And so then what are some of the more extreme symptoms of long COVID?
Well, some people are so, their blood pressure is so out of control on the low side that when they stand up, their blood pressure bottoms out and they can't really stay standing. They have to stay lying down. Some people have, so I mean, you can't function. You can't function. Just such extreme fatigue, inability to think clearly. Those are some of the things that people experience.
And, what about some of the other, I guess, symptoms, if there are symptoms that are more psychological? Depression, anxiety. It's probably you don't know, but whether that's actually linked to long COVID directly or a side effect of having to deal with all these long COVID symptoms.
I mean, it's probably both. And feeling like nobody believes you. Maybe even yourself. You think you are lazy. Your family's telling you, well, get off the couch, get back to work. What's wrong with you?
Yeah.
You have doctors that don't believe there's anything wrong with you. That would be, I think, really depressing to live with.
And so then, is it a matter of just sort of managing the symptoms? Is there a treatment?
As of right now, there's no specific treatment for long COVID. It really is just about managing the symptoms. So we just look at each and every symptom and see what's the best we can do for that.
Right. I want to get to some vaccines for the present day version, though, of COVID that's going around. New FKK study released this morning suggests that many people plan to get the new vaccine shots recommended by the CDC. Could these new vaccines also help with long COVID symptoms as well? And what else, do we know recent studies are showing? Right.
So the KFF polling that just came out this morning was looking at flu, RSV, and COVID vaccines. And what we're seeing is people, they're familiar with the flu vaccine. That's where the greatest comfort is. That's where most people are going to be seeking one out. On COVID, we see a big divide between Democrats and Republicans. Unfortunately, that has been really politically polarized. About half the population is going to get a COVID updated vaccine, but much more likely among Democrats. The other thing that's super interesting, RSV is a new vaccine for people over 60. It has not been politically polarizing, at least not so far. And even though it's a newer vaccine than the COVID vaccine, people are more comfortable across the political spectrum getting the RSV vaccine, which really speaks to how politically polarizing this was.
Completely.
Now,
and just out of curiosity, I mean, because part of the people were sort of concerned about the what they thought was the novel nature of the COVID vaccine. What about the RSV vaccine?
I mean, it's newer, right? So you would think people would be more concerned about that, but actually they're still more reluctant to get the COVID vaccine. So it's not just about, is this new, right? I think this is also very political. Now, going back to your question about long COVID, we know that getting the COVID vaccine does reduce your risk of getting long COVID. Is there a plateauing effect, say after 3-4 doses of COVID vaccine? Are you still getting decreased risk of long COVID? That's less clear. But certainly, especially if you're in a high-risk group, you're 60, 65 and older, you're immunocompromised, you're pregnant, some of these groups, you really should be getting your COVID updated vaccine this fall.
And get your medical information from your doctor, not your politician.
Yes.
Also. Dr. Celine Gounder, thank you very much.